Welcome, everybody. My name is Mary Joyce Bacon. I'm with the Region 4 Public Health Training Center. I'm excited to welcome you to today's webinar on food insecurity and how a lack of availability and affordability of healthy foods affects the health and well-being of vulnerable populations. The webinar today is co-sponsored by Whitefoord and the Region 4 Public Health Training Center. And I'm going to have a few slides to share, if I can figure out how to do that. Let's see, really quickly. Okay. So let's see, advance. Whitefoord is a community-based and driven nonprofit federally qualified health center that is dedicated to provide health care through school-based health centers and in community settings, promoting health awareness, encouraging healthy families, and advancing early childhood development. Their mission is to create health equity by delivering patient-centered health services complemented by other programs, especially early education, that address the social determinants of health. And their website is listed here on the screen. The Region 4 Public Health Training Center is one of 10 public health training centers funded by HRSA to provide training and resources for the public health workforce. The collective group of centers is called Public Health Learning Network. We all work together to improve the nation's public health system by strengthening the knowledge and skills of the current and future public health workforce. We serve 8 southeastern states. The central office is located at Rollins School of Public Health at Emory University, in addition to our 7 community-based training partners and 3 technical assistance partners. Here is the website for the Region 4 Public Health Training Center. And now I will introduce our speakers for today. First, we have Jean O'Connor. Jean is a public health leader and researcher. She is currently the CEO at Whitefoord, and before that, she spent 5 years as the Chronic Disease Prevention Director and Chief Public Health Policy Officer for the state of Georgia. In those roles, she oversaw $30 million of statewide programs related to the risk factors for chronic disease, the state's health improvement planning process, and partnerships to improve population health. Before that, she worked as the Centers for Disease Control and Prevention for the Campaign for Tobacco-Free Kids on international research and as a health policy advisor to the governor. Since 2003, she has also been teaching master's students at the Rollins School of Public Health at Emory and has been teaching in the doctoral program at UGA since 2017. She's a member of the editorial board for CDC's Preventing Chronic Disease. She's the past president of the U.S. National Association of Chronic Disease Prevention Directors and on several nonprofit health boards, including the National American Diabetes Association. She has served as the principal investigator on more than $100 million in cooperative agreements and grants. Her research has been published in journals such as the American Journal of Public Health, Nicotine and Tobacco Research, and Journal of Health Services Research. In 2018, Jean was named to the Fulbright Specialist roster for Global Health and Law. Her JD and MPH are from Emory, and she earned her Doctorate of Public Health in Public Health Leadership at the University of North Carolina at Chapel Hill. She's a member of the State Bar of Georgia and a fellow in the American College of Healthcare Executives. So welcome, Jean. Next, we have John West. He's the Vice President of Programs for the Atlanta Community Food Bank. In his role, John helps the food bank think and act strategically in ways that foster innovation and support communities, partner organizations, and individuals to find creative solutions to increase food access. Previously, John was the food bank's community building manager, where he helped launch place-based collaborative networks of service providers and citizens working together to build stronger, hunger-resilient communities. His very first job at the food bank was painting food drive barrels blue. Before coming to the food bank, John worked with an agricultural relief and development organization in the higher education sector and as a youth mentor in Botswana, Africa. He received his Master of Divinity from Fuller Theological Seminary and a BA in English Literature from Mississippi College. John is married to Hannah, and they live with their 2 children on the west side of Atlanta. So welcome, John. And we also have Chef Asata. Asata Reid is the owner of Life Chef, a culinary and nutrition education service, and she has over a decade of experience as a professional chef and community health educator, conducting seminars and hands-on cooking classes with children, working adults, and seniors. She works as the nutrition health educator at the Healing Community Center in Atlanta, Georgia, and with Georgia Organics to bring farm to school and farm to early care education, professional development, family engagement to preschools and schools. She teaches cooking and nutrition at Drew Charter School, where she also continues the work of Michelle Obama's health initiative, Chefs Move to Schools. Chef Asata is a GACE certified pre-K K through 12 health teacher and a facilitator of Cooking Matters in partnerships with Project Open Hand Atlanta and the Atlanta Community Food Bank. She is also a certified stress management coach and community doula. She is an honors graduate of the International Culinary School at the Art Institute of Atlanta, a cum laude graduate of Florida A&M University School of Journalism, and an honors recipient with a master's in education from the University of Kansas. Chef Asata is currently enrolled at the Rollins School of Public Health at Emory University as a Master's of Public Health candidate 2020, where she will be graduating next week. Chef Asata was inducted into the Atlanta chapter of I need help with this one. Can you help me? Thank you. As part of the class of 2018. She claims her superpower is getting kids and adults to eat their veggies. So welcome, everyone. We're glad to have you and look forward to a great discussion.
Thank you.
Yeah, let me stop sharing my screen really quickly.
So Mary Joyce, I just want to correct the pronunciation. It's Asata, because if I don't, I'll hear Asata for the rest of them.
Please correct me. I'm so sorry.
No problem. It's Asata. Emphasis on the first A.
Asata. Did I get it right? Thank you. Sorry about that. Asata. Let's see. Okay, so as we get started, I have a couple of questions, and we also welcome questions from our audience. As you know, the chat box is there at the bottom, and you can ask questions there, and we will ask our presenters to answer them. So to get us started, my first question is, describe the problem of food insecurity. What are the consequences for families? Jean, do you want to start us off? I can't hear you.
I'm happy to go first, but I was wondering if John wanted to go first because they see so much of it firsthand.
Sure, and welcome, obviously, comments from Jean and Chef Asata on this as well. But as you mentioned, you know, our core work at the food bank here in Atlanta, and I know we've got folks joining us from a wide variety of locations. So just a bit of context for folks on the joining us. We're the food bank who serves the Metro Atlanta area, as well as a 29 county service area here in North Georgia. And in that area, in a normal time, and we are living in not normal times, as we all know, we work to serve almost 900,000 folks across that service area that are food insecure at any point during the year. And what that means, and again, we've got some experts on the line here, I'm sure, is at some point in the year, the individuals in a household don't have access to all the food that they need to live a healthy, active lifestyle. And we certainly have a wealth of data that's available around that. And primarily that data comes from an annual survey that the USDA does across the United States. It helps us get a sense of what that looks like from a numbers perspective. But that data is a survey tool that sort of gives us directional information on what that may be looking like in particular communities. But the impacts of food insecurity are obviously felt at the individual level, right? And in the experience of food insecurity, what we've come to, you know, what we used to think of as a singular term, that individual experience of hunger looks different for a lot of different people across our service area. And there are a number of coping strategies and trade-offs that households and individuals make to help them go through a month and make ends meet while living in the midst of a situation where they may be waking up regularly and are unsure about where their next meal is coming from. And so it's present across our county, our Metro Atlanta area for sure. And because of our current situation related to the pandemic, which I'm sure we'll talk more about later, it is increasingly prevalent as well. So the numbers are significant there.
Thank you, John.
I would just add a few things to what John said. I mean, absolutely, and we see at Whitefoord serving low-income individuals. in our health centers that food insecurity has a wide range of consequences for people, but particularly from a health perspective, we know from the science that some of the consequences are things like potential for anemia, birth defects in pregnant women, things like aggression and anxiety in children. We see those are much worse when families are experiencing food insecurity. We also see that food insecure families will often make those trade-offs that John was talking about, and they will choose processed foods over whole fruits and vegetables, which cost more or can cost more. And eating that kind of a diet over a long term contributes to cancer, it contributes to obesity, which seems sort of counterintuitive. Just because you're hungry, you'd think you would be, maybe not challenged by obesity, but it's the kind of food that people who are food insecure tend to eat. And obesity contributes to diabetes, of which there is an ongoing and has been for a long time epidemic, especially in this state. More than 40,000 new cases of type 2 diabetes every single year. And so we see a really wide range of consequences for individuals. And then we also see them when they're struggling with food insecurity do things like make trade-offs, like John was talking about with their medications, or other trade-offs in terms of just taking care of themselves overall, not getting enough exercise because you don't have enough calories. Sometimes you don't want to waste them, right? Getting exercise, those kinds of things. So we hear and see a wide range of things, and we definitely know that the consequences aren't spread evenly either. So we see that for families where food insecurity is temporary, they can avoid some of those consequences. But for a lot of our families, and I think, about 14% here in Metro Atlanta who are food insecure, it's long-term food insecurity because they're in low-wage jobs and those kinds of things. So we really, those are some of the groups that we are particularly concerned about. And I think in the health sector, there's a lot of recognition of this set of challenges for families. I don't know, Chef, I'm going to get, now that you've said it, I'm going to say it wrong.
Asata.
Do you want to jump onto that? Because I know fruits and vegetables is something you spend a lot of time on.
Yes, and I would say that on the ground, so where a lot of our prevention activity takes place, at food banks, at farmers markets, during this COVID time where there are food pickup sites even, one nuance of food insecurity that kind of gets overlooked is the knowledge of end use at home. I've worked in various settings where people receive food and don't know what to do with it. The general, I'd say, standard American diet doesn't promote a lot of fruit and vegetable consumption in ways that are delicious, nutritious, even engaging and entertaining. Here in the Southeast, we're famous for our meat and three kind of mentality, and those three tend to be smothered in cheese, deep fried, or boiled until they are no longer recognizable. And that's just tradition. It can be tweaked. It's done well in many different ways. That's a whole nother topic for a different day. But a lot of times when people receive food from well-meaning sources, they're not even able to incorporate it into their knowledge base and feed their families. And another wrinkle that has exacerbated this is on the community level. A lot of people are wanting to do good, and they are collecting canned goods, and they are collecting foods that they consider shelf stable to donate to others in the community. And these foods are not necessarily the most nutritious either. High sodium, preservatives, and things of that nature. So sometimes even in the addressing of lack of access, well-meaning intentions still exacerbate the issue of malnutrition.
And I wonder if I could just add real quick there, Jay, just to what Chef Asata was saying there. I think as we were just describing, right, we often go most quickly into talking about food insecurity and the consequences of it in the negative consequences of it in terms of how it affects our health and how it affects the decisions that we have to make as individuals and households. And as Jean was saying, we certainly, this is an ongoing issue here in Metro Atlanta, right before, again, we're living in two worlds right now, pre and post COVID, right? And so sort of pre-COVID, we were on a fairly good trajectory here, still an entrenched issue, but our prevalence rate for food insecurity have been steadily declining over the last few years. And we were actually down to almost an 11% food insecurity rate here in Metro Atlanta, which isn't quite to sort of pre-recession numbers, but we were getting close there. And the child food insecurity rate being around 14%. So still elevated certainly, but heading in a good direction. But what we're seeing now in terms of the impact on the economy, on poverty and unemployment are those numbers dramatically shifting. So we're projecting somewhere around a 16% rate overall of food insecurity for the Metro Atlanta area. And childhood food insecurity jumping all the way up to almost 23%. So almost 1 in 4 kids here in the greater Metro Atlanta area now at risk for food insecurity over the next year. So an increase of almost 150,000 kids who may be newly food insecure because of the impact of COVID across our service area. And there's obviously going to be a huge impact to those things that we were just describing. But I think another piece of food insecurity that I know, Jeff, Asata, you touch on in a lot of your work is not just the negative effects, but what do we lose as individuals and as families, and particularly kids, when we don't have the opportunity to enjoy food, right? So, I mean, if you just paused for a second and thought about sort of your most memorable moments over the last year or two, right? My guess is that, man, I don't know, 80 or 90% of them are going to involve food, right? It's going to be a party with friends. It's going to be a celebration. It's going to be a great dinner somewhere where you are celebrating something special. There are going to be moments that we're allowing you to gather around people that you love and care about and are in community and with food. And that too suffers and is a loss when families don't have adequate nutrition, when they don't have the things that we all associate with celebrating and just being able to thrive and live a normal life. And so that those two are consequences of food insecurity that don't necessarily show up in the data. But if we think about how we want our own lives and the lives of our children to look, I think those can often be motivating things for us to aspire to. How do we get that for our neighbor too? And so I don't want us to lose track that it's not just sort of negative consequences, but there are positive things that really make life robust and flourishing that are often at risk when we don't have adequate food as well.
And I agree, John, because I think partially being a chef, food is at the core of pretty much everything I think about. And the organizations that I've seen really step forward and attempt to bridge this have been faith-based. Just during the COVID experience, I've noticed more churches taking on being distribution sites for food. And on top of that, some of them are even prepared to prepare the food and feed their community. So it's been an interesting shift to watch communities kind of navigate back towards their faith-based organizations as a source for food and nourishment, and that cultural nourishment that you're talking about.
I'm curious, so with the fall school year coming up and the uncertainty that we have around start dates and if virtual versus in person, is there a plan to help students have meals at home, or is there anything in the works to sort of bridge that gap?
I'm happy to make an attempt at answering that question. We had hoped that Dr. Marilyn Hughes, who is the nutrition director for Atlanta Public Schools, would be able to join us today, and unfortunately she was unable to. But I do know that our colleagues in the public health system, in the public school systems here in Atlanta and beyond, of course, work very, very hard to deliver the National School Lunch and Breakfast Program to families. And during the spring, we here at Whitefoord are co-located next to an Atlanta Public Schools facility and operate inside of another one. We got to see them at work, and Atlanta Public Schools took the approach of packaging the food that they would have served on site at school and actually delivering that by school bus to children who would have otherwise been able to consume those meals, which for some kids are you know, 3/4 of their daily calories get consumed at school. So they were able to deliver those meals in various forms to those families. They also have provided pickup options for families as well. And some of that was a little disrupted by COVID, and obviously not the same as being served a hot lunch at school, but certainly they are making those efforts. And I know other school districts across the state have done similar things to make sure that the children who participate in those programs have continued to have access, and they'll start again doing that when school begins. But one of the things we've seen at Whitefoord is over the summer, some of those families going without access, particularly because of the social distancing issues. And we've actually become one of the mobile sites with Atlanta Community Food Bank for pickup, and really seeing a very wide range of our community members coming for food pickup. But the preparation is something I've been wondering about. Do people have the skills to use all of those things that they're picking up? So it's a lot of challenges, but I think our partners in the school system are working really hard to try to meet the needs of the children.
Good.
The only thing I might add there, just again, because I think that question in particular just sort of it really does highlight sort of the challenge of the moment that we're facing, right? And I'd echo everything that you said there, Reid, just in particular, just around sort of I think the Herculean effort that our school nutrition folks engaged in as school was being disrupted at the end of the school year. I mean, every one of those folks needs big raises and big hugs for all the work that they did to really try to continue to provide those meals for families and kids. But again, that system, right, exists to provide meals for students that are on site at a particular campus, right? And so what every school district is struggling with, to your point, MJ, and your question, is how do we pivot and take a system that was designed to do one thing to now turn it into a crisis and emergency response system? And that is just so hard to do. It's hard from everything, nuts and bolts, to finances, to communication, and so I think one way to answer your question is there's not a plan. There's 150 or 200 and 250 plans, right? Like every school district is right now doing the best that they can to figure out how do they continue to provide nutrition to their students in what's going to be a very strange school year. And there are some infrastructures in place at the federal level to support that. And I'll mention something now, just because it's relevant to this part of the conversation, is that there are things that the federal agencies can do to simplify some of those processes. There are waivers that are available, and I think for the most part, the federal government has been pretty proactive in making those available. And I think where we're at now, or we're in those moments where we need those extra permissions and waivers and flexibilities to be continued and extended. And so an action item out of this is for anybody who has a voice in that to be a voice for supporting those schools to have as much flexibility as possible in the administration of those programs in the upcoming school year, because that's ultimately what's going to be able to help kids the most, is to give schools as many options as they have to get food to kids is going to be really important.
And I'd like to put in there, since you brought that up, John, a really good point about subsidiary services for after-school programs, other nonprofits that service children, sports teams. If you are a nonprofit and have not looked into becoming a CACFP vendor or sponsor, now may be the time to do it. I am not well versed if there are waivers on the process. It's typically like a 2-year process, but in this time of need, when we need to feed as many kids as possible, I would definitely look into, or if anyone on the policy level can shift that, making more nonprofits, vendors and sponsors to get food to kids in after school and sports settings, because they're still happening. After school and school sports are still happening in different levels at different schools.
That's a good point. Let's see, we have some questions that have come in on the chat, and I'd like to make sure we have some time to get to them. you mentioned, John, about policy, and this is a question that kind of goes with that. So what are the potentially most impactful macro policy changes, state, federal, it's a hard question too, but state, federal, local levels that can reduce food insecurity? Does anyone have any comments around macro policy changes that could reduce food insecurity?
I know John just mentioned, one piece about kind of extending the current waivers, and there are so many important programs, I believe, out there. SNAP Ed, which provides education to families who utilize the SNAP program around how to prepare food. WIC, which has really had to adapt in the current environment to ensure that families of very young children and pregnant mothers have opportunities for, consuming all the foods that are necessary to early brain development. Those programs are incredibly important, and enrollments in those programs are going up, and states really, funding is needed at the state level to support, demand for those programs, as well as at the federal level. Funding is always obviously an issue for everything. But I did also just want to put in a sort of plug for the person who asked this question. There's actually a report that was put out by HHS, and I participated in writing that report around laws and policies that could support fruit and vegetable consumption. It's specific to fruit and vegetable consumption, not all food security issues, but there are some recommendations that are out there that do exist about some of the specific opportunities in communities. I think that was written before COVID, though, and I think one of the things we know right now is like literally putting things in people's hands is probably one of the most critical things that we can be doing right now at this time. And so anything that helps to support that, done well, done by the food banks and other reputable kind of partner organizations, is really, really important to the overall well-being of our communities.
And also stretching the existing dollars, like through programs here in Georgia with Wholesome Wave and other grocery markets, like the Carver Community Food Market, where they will double EBT value for produce. So again, we're looking at consumption of fruits and vegetables. I believe there's a couple of Wayfield foods. I mean, it requires a little research on the part of individuals who receive EBT benefits, but they can be doubled and stretched in certain locations. Again, with a lot of these kind of social ecological factors, transportation then becomes an issue along with social distancing. So it's not just as simple as just getting up and going to the store. If you have 3 young children at home, now they have to come with you, and it gets compounded. But again, we're just trying to expand the buying power as well.
Yeah, and some of the things that our audience, if we work with populations that, the knowledge to know that, to the research that you mentioned, we could help with that, right? We can help do some of that research and then educate families on where they can double their benefits. Chef Asata, this question is for you. What are some ways service providers can address food insecurity in a more culturally appropriate, community engaged way? This is from Kimberly.
I will take a couple steps back to pre-COVID. And one of the breakdowns, I think, in health education in a culturally sensitive way is lack of understanding the culture which you're trying to serve. Also, as much as we love to see people consuming more fruits and vegetables, if your basic needs of housing and electricity are not covered, that's just not a nonsensical agenda to push. It is very important to know who you're serving and what their needs are, not what you think that their needs are. If the bigger issue is my children don't have devices and internet at home, we're okay on ramen noodles and Vienna sausages, they can't do homework, then you coming in with foods and fruit and vegetable prescription programs isn't fitting their needs. So to make things more culturally relevant, do your homework first. Second, leave your food biases at home. I have been in situations where generous donations from the food bank were made available to people, and there was sort of a pre-cleanse that went on to say, this isn't healthy, this isn't healthy, this isn't healthy, and they pulled it out and didn't leave it available for the people to receive the food. That's not really your role in a situation where there's food insecurity and nutritional deficits, and especially during the time of COVID. If someone has made it to your donation site, they're the ultimate authority on what they do and do not eat, not you. So take your very well educated self out of the picture and let people do what they do right now. I don't think now during the time of COVID, I'm not gonna say it's not a time for education, but education might need to step back a step or two, and let's get some food in some bellies. People really just need to operate and be able to function and feel human and be recognized where they are. People are coming to you because they need the food. If they pull up in a BMW and are wearing a mink coat, that's not your call. Give them the food.
Thank you. Oh, actually, I'm going through the chat, and so we have one more question. What is the name of the grant to feed the children again?
Oh, the CACFP. So that's not a grant.
Okay.
That is a federal reimbursement program for nonprofit organizations who are in positions to feed children. It could be schools or nonprofits. It's a bit of work to go through, but it stands for the Child and Adult Feeding Program. And it is worth investigating if you are a nonprofit, to see if you are eligible, first of all, and to expand more feeding sites in the community. Usually it's libraries and churches and places like that, but I have known softball teams, little league teams to be able to offer food to children. Right now we're in the summer feeding program kind of bridge that they do in between the school year. And normally that would be a place where YMCAs, Boys and Girls Clubs, would be distributing food, free lunches in the community. Well, these places are not necessarily open due to social distancing restrictions. So who amongst the community, what nonprofits do we have that can pick up this slack? These are the folks we need to stand up now. It is a learning curve, but here in Georgia, the folks that Bright from the Start will walk you through it and hold your hand. It is worth it so that we have more of these organizations and we're not relying so heavily on just schools and just churches and just Boys and Girls Clubs to feed our community. Again, that's CACFP.
Thank you. Another question, is there an app for SNAP recipients that helps folks find farmers markets where double benefits can be accessed? That's a good question.
That's a good question, if there's an app.
I don't know if there's an app, but if you Google Wholesome Wave, they do a pretty good job of maintaining a national database on that, and on their website. And they may have an app that I'm not familiar with, but they do a pretty good job of being a clearinghouse for that information nationally.
And speaking of apps, I do want to throw out, is it Cooking Matters? Their app is really useful for low cost yet healthy recipes that are easy. So if you're looking to utilize some of the food, if a family is looking to utilize some of the food, get more familiar with cooking processes and just that skill level, that's an easy navigatable app.
What is it again?
Cooking Matters.
Oh, Cooking Matter, yeah.
Yeah.
I was trying to kind of type them in the chat so people, if they missed it. Excellent. Let's see. Maybe a broader question. How does food tie to health equity? For example, the link between food insecurity and obesity. What about for children?
I mean, I think we touched on this a little bit already. I'll jump in and then others can jump in. I mean, food is obviously incredibly important to lifelong health and well-being. So we talked earlier about not just avoiding bad consequences, but also feeling good. It's part of most cultures. It's part of most of us every day. It is the thing that brings us pleasure, and one of the things that brings us pleasure. And so, the way that your body and mind work together, I personally believe is, food is an important part of that, how you fuel your body. And so for young children, we know that diet has really important consequences for their well-being, development, and health, and including, even before they're born, critical to brain development. And so, getting the right mix of the right nutrition for the right stages of development, and avoiding processed foods, avoiding too much sugar if you can, avoiding too many saturated fats, those things are important to young children as well, although they have sort of different needs, right, around things like sodium and fat. Protein, they need maybe more of some of that than adults do. And so, when you consume too much sugar, it can really have kind of a negative consequence in your metabolic processes and that kind of thing, and really contribute to additional, sort of laying down additional body fat that you don't need for growth and development. And so there's really a lot of opportunity for parents and families to educate themselves on the specific nutritional needs of children, and there's a lot of great material out there on the web, and the American Academy of Pediatrics has recommendations out there specifically for children, because their needs are different from adults, and their needs change pretty quickly as they grow. But definitely, avoiding obesity at a young age is important in terms of lifelong health, and there's some data out there around obesity at a young age contributing to obesity rates at older age groups as well, including into adulthood. So young childhood is at a really important time for children, and they're really very sensitive. It's also a really important time for them to develop a like for things that they might, not have an opportunity to eat as often as we would all like, but that's when your taste buds and your sort of sense of what, tastes good to you begin to develop. And I'm sure Chef Asata could talk a little bit about how, how exposing children can really help them develop a lifelong like or love for some food groups.
That's true. I think we've all heard those statistics. Children need to be exposed up to 12 times, before they like something. But, and this is actually where my thesis is based, it's deeper than that. It's not about what children like. It's are they self-aware? Have they been taught? Do they know what they need? Do they know how to access it? Do they know what it does for their bodies? These are conversations that aren't really being had with children because we're so focused on what they like. Well, what they like is Skittles and hot Takis, but that has nothing to do with their nutrition, and they're able to differentiate the two. They know the difference between taking some change to the corner store and buying up some junk and fueling their body, even if it's at that same corner store. I've come up with cooking programs that were based at Dollar General, okay? Because you can make healthy choices at the dollar store, but someone has to teach you how. And if you knew this would prevent disease in your future, if you knew this would help you learn in school, if you knew this would make you a faster football player, you would make different choices. Children and adults both, but children in particular, I think, are doubled down with the negative effects of food insecurity because they don't know what they don't know. A hungry child just wants to eat, and hot Takis and Skittles are yummy, and I only have $3.75. So what kind of choices can I make for where I can walk or catch a bus or catch a ride if I'm in a food desert, especially if I have not been taught that eating fruits and vegetables is not just healthy, it's normal. So if you come from a personal home culture or home environment where healthy eating has not been normalized, again, you don't know what you don't know. You can't make healthy choices. So the children are not only impacted by their environment, being in a food desert, being food insecure, but they're also catching the fallout from parents who also don't know. So it's a double down effect on children. We love to focus on children and show them all the right things to do and give them my plate diagrams to go home. But by and large, children do not purchase food for the family. We have a lot of research that shows they have a huge influence. The Lucky Charms are there because some kid wanted it, but they don't have the ability to just pull the trigger and make the final choices. And again, even in the food donation sites, You have parents making choices of what they're going to pick up and bring home. That's what the kids are going to eat.
Chef Asata, do you have any resources for people on places to go to direct families for recipes or things to do with, you know, if say they are able to get healthy fruits and vegetables, but they aren't sure what to do with them?
Well, to keep it easy, because I think the skill set and the time involved in this commitment to this new skill of cooking still needs to be minimized. I know in COVID, there's a whole lot of people planting gardens and making sourdough bread, but that's not everybody. There are still people going to work and they need quick and easy. I will reiterate Cooking Matters as a source, but actually Eating Well, the website, Eating Well delivers. It gives you recipes that you can choose if you want vegetarian or low fat or whatever. And then they deliver recipes that also have reviews. They've already been reviews, and it saves a lot of time for you to make a recipe and actually have it come out right. Recipes right now, though, I mean, if you have the internet at your fingertips, recipes are easy. That's the easiest part of preparing food, because there's so many of them out there. You just shift through, find the ones with 5 to 7 ingredients, and that's the one you go with. Keep it simple, especially if you're new to cooking. Keep it simple and don't be intimidated. And the real root of flavor is, if you have access to farmers markets right now, the fresh, seasonal, local stuff. If you were lucky enough to plant a garden, the best tomato you'll ever get is the one growing in your yard. They don't get any better. And then learn how to use herbs and spices instead of salt and fat. That keeps it light, keeps it healthy.
Excellent advice. We had a question. Please.
One thing, just back on the health equity question that I think is increasingly on our minds at the food bank that we don't have great answers for, because it's a larger issue than just our work in our particular sector, is that what we are hearing and seeing from survey data that we do at a national level across our network and then some local work as well, is that one way that families and individuals sort of enter into being food insecure is that there's some triggering event in their household or as an individual, right? And increasingly the event that sort of puts a family or an individual on a trajectory towards food insecurity is a health crisis. It's a health problem or an issue. Maybe it's a long-term one, or maybe it's something like a car accident where they have a health issue. And they don't have health insurance, and they don't have regular health care. And so the costs of responding to that health event start them on that downward spiral for then having to make those sorts of trade-off decisions, because the first thing that most folks do is they begin making trade-offs on their food, right? They begin adjusting that food budget. They lower the quality of food that they're eating. They eat a little bit less. And when you're already in a health crisis and trying to respond to that, even if you're not the individual who's directly affected by that, that begins to have compounding effects for the whole household, right? And those trade-offs that you begin to make in food eventually creep to you having to make a decision around trade-offs for your utilities, or trade-offs for the rent, or trade-offs for medicine that you're having to get. And so that triggering event that we are increasingly seeing that starts an individual or a household sort of in that food insecurity spiral is a health crisis event. And I think a big part of that is certainly a health equity issue.
I wonder how much unemployment or decreased revenue due to COVID is going to fuel that going forward too.
A lot. I think what we're seeing in that projection data that I mentioned earlier is the sort of, and they're, everyone's trying to project everything right now. And so I'm typically skeptical of that on some degree, but we need some directional guidance here. And so a number of scenarios are being plotted around where does unemployment land, and where do increases in poverty land, and what does that mean for drivers of other social determinants of health like food insecurity. And what we're seeing right now is that the fairly conservative estimates on that are to expect 30% increases in food insecurity almost across the nation. And that's directly as a result to those losses of household income that you mentioned, Chef. So again, it just makes me think back to something you were mentioning earlier around what people can do now. And I think what we need to do is, and what we're increasingly trying to do ourselves, but it's hard, is to have our eyes on the horizon a little bit on this issue, right? Because this is not going to be an August issue, a September issue, an October issue. This is with us. This is with us for a while. The effects of the Great Recession were with us in terms of elevated food insecurity, even to today. We are still not back to pre-recession levels in terms of food insecurity. And so this is going to have legs, and we need to be thinking not just about solutions for the next couple of months, but how do we build infrastructure, like you were mentioning, that can support continued community responses for the next year plus.
And I was going to ask you that, John, because you do have such a high view of this sort of beast of food insecurity and what has happened in COVID. If you could make 3 recommendations for communities to galvanize grassroots, where would you suggest they even start?
That's a great question. And I mean, one, I would say that one thing that's already been mentioned, I think, by both you and Jean, is just to sort of, hey, who's doing good work now that we can figure out how to get more resources to, right? I mean, and that's sort of how we think about responding in the moment. What's working? Can we do more of it, right? And can we get resources to organizations that are already working really hard to meet the need, and make sure that they don't just get burned up and disappear because they're trying to respond to a crisis, right? So can we bring along resources alongside those folks that sustain them? The second one is back to the policy question that MJ asked. There are in that area too, there are things that work that need to be more robustly funded. I mean, the really basic one in our world is SNAP, food stamps. There's a broadly supported bipartisan recommendation making its way through the Capitol right now to do a blanket increase of SNAP dollars by 15% across the board. And that's not a huge lift in terms of the dollars, but would have a tremendous impact in terms of putting dollars and resources directly into the hands of families so that they can make decisions about the food that they need. So supporting that would be a really easy one. And then I would just say that we need to be thinking about our most vulnerable populations. So our kids, our seniors, folks with limited mobility, folks with disabilities, under-resourced and low access communities already. So what do we need to be doing locally to think about how to respond to those particular groups? And that's going to look different from place to place and group to group, but there's a lot of space as Jean and the team there at Whitefoord has demonstrated, for local organizations and institutions to step up and fill the gap where folks are seeing it, and you can do a tremendous amount with that. So I think that'd be 3 quick things that I think would have both current, real impact in the now, but set up for a trajectory of how do we support people long term.
Thank you.
John, can I add one thing to that, which is just to say the piece about, the vulnerable populations. And I think, with programs like even the mobile distribution sites and programs like SNAP-Ed, where historically people have come to the location, right, and then been given something, whether it's education or food. I think recognizing that is becoming increasingly more difficult, and that we may need to think about other approaches for delivering that kind of information or the product, because we're seeing that even in just our small experience as a distribution site, that people who normally might have come can't come, or afraid to come, or they're coming and they're picking up for quite a few other people because they're taking it back to a retirement community, or they're taking it back to a neighborhood or an apartment complex where people don't have transportation. And so, we've been watching that and thinking about that, and realizing that this also may be kind of another shift that if we're really going to meet people's needs long term, we're going to have to figure out how to do, especially in a city like Atlanta where transportation is an issue for a lot of people.
Yeah.
We had a question in the beginning that I overlooked by accident, so I was going to come back to that one. So what are the most significant components of food insecurity? Certain vitamins, protein, vegetables in general, or a lack of calories? Is there an indicator for barely food secure? Is that?
I would add that one, and this isn't all, is the difference. Well, okay, with lack of calories, it's lack of nutrient density. Mm-hmm. This is how you can be poor and food insecure and still have obesity issues. the calories that you are consuming exceed what your body needs, but they also don't bring the nutrition that your body needs. So for just an example, a pack of potato chips has 100 calories, but it's just giving you carbs and fat, versus a turkey sandwich that may have 100 calories, which is going to give you carbohydrates, protein, maybe some lettuce, tomato, and cheese, some fat. So it's the distribution of those calories that's part of the problem. And so we've got, I'll say kids in particular, running on fumes, but consuming a tremendous amount of calories. The excess calories contributes to the obesity, but the lack of nutrition has them unable to focus in class or has them fighting in the hallway, because even though this child has consumed 2,000 calories, they're technically hungry.
Thank you. Good point.
Yeah, this is not my arena, so I'm trust everything everybody else says more than me on this. But just the one piece there that I might add to is, you know, again, in the technical definition and data around food security, there are degrees that are measured there, and folks can find information on that on the USDA's website. I think they do a pretty good job of describing that. And there are degrees that are categorized at marginal food security, low food security, and very low. And the shift there happens in the survey tool based on the degree of disruption that a household experiences around the quality and frequency of their food eating patterns, as Chef Asata was describing there. But there's more information out there than I could intelligently speak to.
And the other indicator that gets used in a clinical setting is this question that the American Academy of Pediatrics recommends be asked of parents and families when kids come in for well child visits. But it's this question about, do you have trouble making ends meet at the end of the month or at the end of your paycheck cycle? And that is really meant to be sort of a broad measure of all of the things that could be disrupting a household, including, you know, food, or are they making other choices like not paying utility bills and that kind of thing because of their income insecurity. And then from there, you know, it can open up that question about specifically about food insecurity or access to food resources. And so those are some measures. I think that was a question somebody may have asked as well, sort of indicators. That's another way that in the clinical system we try to get at questions about the family, and we try to ask that visit. It's recommended that get asked at every visit.
We are out of actually questions from the audience. Are there comments or anything that you as panelists would like to share that I haven't asked or that we haven't asked? Oh, there's that one came up. Do you all think food trucks will help fill in the gap of food insecurities in relation to transportation issues? If so, how could someone get funding for a food truck?
I've seen them be used. I think it depends on the intended use of the food truck. If it's just commercial, not so much, but we do have resources, county resources, that deliver farmers markets via food trucks. And we do have distributors who will pick up from food banks and use their trucks to get the food to, say, a co-op of people who all benefit from the food bank. So I think the intended use of the truck is one thing, and they definitely have stood in the gap, especially with Jean's comment on the transportation issue. Transportation is an issue anyway in a city like Atlanta, but you add to it someone who is immunocompromised or an elder person who has chronic disease, they're not going to want to necessarily get on a bus. Now you have to judge, am I risking my life to go get food, or do I just stay home where I'm safe and do the best that I can? So I do think that trucks could help fill in the gap, the transportation gap, and make available food more accessible, because there's an accessibility issue. As for funding, I have no idea.
Yeah.
I would just add that, I think obviously the better solution long-term is to have permanent places where people can access healthy food within walking distance of where they live, right? That's ideally what we want. And there's been a lot of work done to try to help support corner stores in transforming what they sell and helping them find profit in selling food choices that are healthier, and access to fresh fruits and vegetables in those kind of neighborhoods where that may be the only store available to people. That obviously that kind of walking distance kind of is far better than depending on someone coming to you with a truck, right? But I do think in the short term, we're also seeing the power of these mobile distribution sites. And I don't know, John, if you want to talk about that, because I feel like that has been for the community that we serve here at Whitefoord. We've really seen a pretty tremendous response and a lot of gratitude for kind of having the mobile site available.
And I think the only thing, I mean, y'all touched on everything I'd say there. I mean, on the funding piece, I'd just say, you know, there's always funding for good ideas. So if you can make a good idea and a good case for it, the funding's out there. But certainly, you know, the challenge at the moment, because of all the disruptions to our normal ways of operating, are, you know, the places where families and individuals, particularly kids, in the summer and then continuing the school year, where they're used to finding those food resources just aren't open. They're not there. And so all the challenge has been, how do we stand up alternate locations for folks to access this food? And thankfully, wonderful folks like you all at Whitefoord have stepped up and said, hey, you raised your hand and said, we'll be those people. And so, and we've have been oftentimes able to respond by being able to provide that food. So if there are if there are individuals, communities, anybody on the line here who's interested in finding ways to explore that, I mean, I would encourage you to call your local food bank. And if you're not sure who your local food bank is, go to feedingamerica.org, and that's our national umbrella network of food banks, and you'll be able to find that there. But that model of mobile distributions is a normal way that we operate, even pre-COVID, but we have grown that distribution model by almost 300% in response to COVID, directly because of the issues that Chef Asata and you were just talking about, that are challenging for folks to access nutrition right now.
And if there are two skills that any organization could help empower adults with, I would recommend growing food and cooking food. Again, we can get food to people, but if they don't know what to do with it, if they're, you know, afraid of brown rice or however complicated or simple it is, that's not helping them. We really have to empower people that they can cook. Anyone can do it. And even in simple things like electric skillets or stovetops, you know, where if there is an issue with power, and then growing food, because I think a lot of people experienced this year with their first garden. Gardens are very bountiful. And if you're growing cucumbers right now, you're very aware of that. You may not think you can feed a family of 4 or a family of 6, but what I think the breakdown is when you get all of these cucumbers or you get all of this squash, we go back to, I don't know what to do with it. It was great to grow it. That was fun. Now I'm in over my head. I don't eat this food. This is not known to me. So we're still going back to the cooking skills.
Yeah.
And if there's a way to bridge what grows seasonally in your area with some basic recipes, you may just be able to find a sort of a patch for home growers and home cooks to feed themselves.
Thank you. Before we wrap things up, there was one more question that just to see if anyone has resources for ways to connect small farmers with places that have food deserts, or hydroponic farm efforts targeting those to reduce food insecurity. Any comments around either of those?
I would just say we have some examples of urban and local farms right here in Atlanta, and Georgia Organics is a great resource. And then also in the report I posted, the Healthy People 2020 report, there are a couple of examples highlighted in there where cities have done a lot to kind of try to make those things available in their cities through policy change. So just maybe take a look at that report too.
And reaching into school districts. I've worked with several school districts who work with local farms. I think there's one county that gets all their lettuce from a hydroponic farm right here. They have that kind of contract. So schools may not be physically there, but they still have the staff and the equipment to prepare meals. This may be a pivot that you can negotiate in your community. Would also go into senior centers and senior housing, like the housing authority, and see if there's need and use for your produce there.
Thank you. All right, well, that is about all the time we have. Participants, thank you all for joining. I hope that you enjoyed the webinar. And thank you to our presenters. This was a great discussion, and everyone have a good rest of the day.
Thank you.
Okay, thanks. Bye.
Bye, thank
Thanks, everyone.
you.
Yep, bye.